So 15 new cases today, a total increase of 13. I don't like to see a number that's in double figures and not in single figures, and no one obsesses over the daily numbers more than me or my team. But they are, again, predominantly related to known cases, to outbreaks, and we have to get on top of these outbreaks to really drive these numbers down. The Chadstone outbreak is an illustration, again, of just how significantly this can spread far and wide, and the particular challenges we have in outbreak management. There are now 28 cases with the Butcher Club outbreak in Chadstone. That's 8 staff, 11 family and household members of existing cases, and 4 customers of the Butcher Club. The Kilmore case is in addition to that, and it's been called a different cluster just for logistical management purposes. But the challenge in this, I spoke to it yesterday, the challenge in this wave in Victoria is profoundly different to the first wave. It's profoundly different to what any other jurisdiction in Australia has followed up. I don't think anyone really understands what a gargantuan task the contact tracing has been through this wave. I think the average family size in Australia is about 2.5 people. We've made estimates that the average family size for the 20,000 cases in this second wave has been between 6 and 10 people. And so when there's a case in a household, you're not looking at one other contact or 2 other close contacts. You're looking at 5 or 6 or 7 or 8 or 9 routinely for every single household. And you're not looking at no other workplaces where those close contacts might be. You're looking at 3 or 4. And again, with each of those individuals who are in workplaces, they will have their own households, and they will have 5 or 6 or 7 or 8 close contacts. So it is, it's not twice as hard as the first wave, it is 10 times as hard as the first wave in terms of the challenges of following up these cases. Many of them come from difficult social and economic circumstances, certainly not everyone, but there are challenges with respect to that as well. But we are jumping on each and every close contact on each and every case in a very timely way. The Kilmore case is an illustration of a cafeteria that did all of the right things, has a fantastic register of names. All of those close contacts are being contacted, but there are 150 of them. So again, the infectiousness of this virus and the opportunity to have dozens and dozens of people potentially exposed speaks to the challenge. But the testing will happen at Kilmore. People without symptoms can present there and will get tested. And obviously we're asking anyone who's got symptoms to isolate and absolutely make sure they get tested, absolutely make sure they're not in contact with others or going to work or going to public places. In addition, the Chadstone shopping testing continues, asymptomatic testing as a walk-in site at Chadstone and a drive-through in the car park for any symptomatic customers over that relevant period of time. Updates every day to the DHHS website with exposure sites, and they remain valid for 14 days if you've got no symptoms and you've been to one of those exposure sites in the last 14 days, and you go beyond that 14 days, then you're safe, as it were. But any time within that 14 days, you could develop symptoms and you should get tested.